Uncle, have you ever felt your heart beating faster after a drink? Or woken up in the morning with your blood pressure fluctuating for no clear reason? Many people think that a little alcohol or a few cigarettes won't do any harm. But do you know? These habits can silently damage your heart health, increase the risk of stroke, and make it harder to control your blood pressure over time. So how do alcohol and smoking affect blood pressure? What are the real risks? And what can you do to protect your health? Let's find out together right now, because the information ahead could help you live a healthier life every day. What is blood pressure? Blood pressure is one of the vital signs that reflect a person's cardiovascular and circulatory health. It is the force exerted by blood against the artery walls as the heart pumps it throughout the body. Blood pressure is measured using two key numbers. Systolic pressure. This is the pressure in the arteries when the heart contracts to pump blood out. It reflects the heart's contraction strength and the elasticity of the artery walls. Diastolic pressure. This is the pressure in the arteries when the heart is at rest between beats. It indicates the relaxation and flexibility of the blood vessels as blood circulates. What is a normal blood pressure reading? According to the American Heart Association AHA, normal blood pressure for adults is defined as below 120/80 mmHg. The specific classifications are optimal blood pressure, below 120/80 mmHg, elevated blood pressure, 120-129/80 millimeters of mercury, hypertension stage 1, 130-139/80-89 mmHg, hypertension stage 2, 140/90 mmHg or higher, severe hypertension, 180/120 mmHg or higher, which may lead to serious complications and requires immediate medical attention. If high blood pressure persists, it can result in serious health problems, such as heart disease, kidney failure, brain damage, and other severe complications. On the other hand, excessively low blood pressure may cause dizziness, fainting, and reduced function of vital organs. The importance of maintaining stable blood pressure. Keeping blood pressure stable is crucial for overall health, especially for the cardiovascular and circulatory systems. Managing blood pressure within a healthy range helps reduce the risk of serious illnesses and improves quality of life. 1. Reduces the risk of cardiovascular diseases. High blood pressure is a major risk factor for several heart-related conditions, including heart attack. Increased blood pressure puts extra strain on the heart, making it work harder and increasing the risk of heart attack. Stroke. High blood pressure can damage blood vessels in the brain, significantly increasing the risk of stroke. Heart failure. Prolonged high blood pressure weakens the heart, reducing its ability to pump blood effectively. 2. Protects kidney health. The kidneys play a crucial role in regulating blood pressure and filtering waste from the body. Chronic high blood pressure can damage the small blood vessels in the kidneys, impairing their ability to filter toxins, which may lead to kidney failure requiring dialysis or transplantation. 3. Prevents eye damage. The eyes contain many tiny blood vessels that are vulnerable to high blood pressure, potentially leading to retinal hemorrhage, ruptured blood vessels in the eyes, which may cause vision loss. Hypertensive retinopathy. Damage to the retina's blood vessels, affecting eyesight. Glaucoma. Increased eye pressure, which can harm the optic nerve and lead to permanent vision loss. 4. Lowers the risk of cognitive decline and Alzheimer's disease. Studies have shown that high blood pressure may increase the risk of cognitive decline, dementia, and Alzheimer's disease. This occurs because high blood pressure can damage brain blood vessels, reducing blood flow and affecting nerve function. 5. Enhances longevity and quality of life. Maintaining stable blood pressure allows the body to function efficiently, reduces the risk of chronic diseases, and promotes a longer, healthier life. Individuals with controlled blood pressure are less likely to suffer from heart and neurological complications. How to maintain healthy blood pressure. Here are some essential strategies to help regulate and maintain normal blood pressure. 1. Follow a healthy diet. Reduce sodium intake, less than 2,300 milligrams per day, to prevent water retention and high blood pressure. Eat more vegetables, fruits, whole grains, and potassium-rich foods like bananas, sweet potatoes, and lentils. Limit processed foods, fast food, and items high in saturated fats. 2. Exercise regularly. Engage in at least 30 minutes of physical activity daily to improve heart health and regulate blood pressure. Recommended activities include walking, swimming, yoga, and aerobic exercises. 3. Maintain a healthy weight. Being overweight increases the risk of high blood pressure. Keep a BMI between 18.5 to 24.9 to reduce cardiovascular strain. 4. Limit alcohol and quit smoking. Excessive alcohol consumption can raise blood pressure. Smoking damages blood vessels and increases the risk of heart disease. 5. Manage stress. Chronic stress can lead to elevated blood pressure. Meditation, yoga, deep breathing exercises, and adequate rest can effectively reduce stress levels. 6. Regular medical check UPS. Monitor blood pressure regularly to keep track of cardiovascular health. If diagnosed with high blood pressure, follow medical advice and treatment plans strictly. Blood pressure plays a crucial role in determining cardiovascular and overall health. Maintaining stable blood pressure helps prevent life-threatening diseases and enhances quality of life. By adopting a healthy lifestyle, managing stress, and monitoring blood pressure regularly, everyone can protect their heart health effectively and sustainably. The impact of alcohol and beer on blood pressure. Alcohol and beer are common beverages in social life, but few people fully understand their negative effects on health, especially blood pressure. Consuming alcohol and beer can affect blood pressure in various ways, from temporary spikes to long-term consequences that pose serious cardiovascular risks. Temporary blood pressure increase. According to medical studies, drinking more than 3 glasses of alcohol or beer in one sitting can cause a sudden increase in blood pressure. This occurs because alcohol stimulates the sympathetic nervous system, causing an increased heart rate, blood vessel constriction, and consequently, higher blood pressure. If this happens frequently, the body may gradually adapt to a higher blood pressure level, leading to chronic hypertension. Additionally, alcohol consumption triggers the release of large amounts of catecholamines, hormones that play a crucial role in regulating blood pressure. When catecholamine levels rise, pressure on blood vessel walls increases, resulting in sudden high blood pressure, which raises the risk of heart attacks and strokes. Weight gain, a risk factor for hypertension. Alcohol and beer contain a significant number of empty calories, calories that provide no nutritional value but contribute significantly to weight gain. A standard beer contains around 150 to 200 calories, while stronger alcoholic drinks typically have about 100 calories per serving. Frequent alcohol consumption, without proper diet control and exercise, can lead to fat accumulation, especially belly fat. Weight gain not only increases the risk of metabolic diseases, such as diabetes and lipid disorders, but is also closely linked to hypertension. As body weight increases, the heart must work harder to pump blood to all organs, raising arterial pressure. As a result, blood pressure tends to rise over time. Interactions with blood pressure medication. Many people with hypertension take medication to manage their condition. However, alcohol consumption can reduce the effectiveness of blood pressure medication or even cause dangerous side effects. Certain medications, such as beta blockers, ACE inhibitors, or diuretics, can react strongly with alcohol, leading to sudden blood pressure drops or abnormal spikes. Additionally, alcohol can amplify medication side effects, such as dizziness, nausea, dehydration, or electrolyte imbalances. This is particularly dangerous for older adults, who may be at greater risk of falls due to fluctuating blood pressure. Scientific research on alcohol, beer, and blood pressure. Studies from leading global health organizations have established a strong link between alcohol consumption and hypertension risk. Mayo Clinic states that drinking more than 3 alcoholic beverages in one sitting can cause a temporary increase in blood pressure. If this habit is repeated often, it may lead to chronic hypertension. WebMD reports that excessive alcohol drinkers are at higher risk of developing hypertension compared to non-drinkers or moderate drinkers. The American Heart Association, AHA, warns that heavy alcohol consumption can negate cardiovascular benefits while increasing the risk of severe heart diseases. Research also indicates that alcohol can disrupt the renin-angiotensin system, a crucial endocrine system for blood pressure regulation. When this system is imbalanced, blood pressure control becomes less effective, leading to prolonged hypertension. Practical advice on alcohol and beer consumption. To protect cardiovascular health and maintain stable blood pressure, individuals should adjust their drinking habits wisely. Limit consumption. For men, no more than 2 drinks per day, approximately 300 milliliters of beer or 150 milliliters of wine. For women, no more than 1 drink per day. If you have a history of hypertension or are taking blood pressure medication, it's best to limit alcohol intake to a minimum or avoid it entirely. Choose healthier alternatives. Instead of alcohol, opt for beverages that benefit your health, such as water. Helps maintain proper hydration and stabilizes blood pressure. Unsweetened fruit juices provide essential vitamins and minerals without causing sudden blood sugar spikes. Herbal teas. Certain teas, such as green tea or ginger tea, can help relax blood vessels and support blood pressure control. Medical consultation. If you have hypertension, consult a doctor about alcohol consumption. Some individuals may need to avoid alcohol entirely to achieve optimal blood pressure control. Additionally, regular blood pressure monitoring can help track how alcohol affects your body. Alcohol and beer can have significant negative effects on blood pressure, ranging from temporary increases to severe cardiovascular risks. Uncontrolled alcohol consumption can also lead to weight gain, medication interactions, and hormonal imbalances. To safeguard your health, limit alcohol intake, opt for healthier beverages, and seek medical advice when necessary. Proper blood pressure management will help you maintain a healthy heart and enjoy a longer life. The impact of smoking on blood pressure. Smoking negatively affects blood pressure in multiple ways, leading to severe cardiovascular health consequences. Temporary increase in blood pressure. Nicotine in cigarettes causes blood vessel constriction, leading to a temporary rise in blood pressure immediately after smoking. Frequent smoking can result in consistently high blood pressure levels. Blood vessel damage. Chemicals in cigarettes damage blood vessel walls, reducing artery elasticity, increasing the risk of atherosclerosis, and making blood pressure harder to control. Increased risk of cardiovascular diseases. Smoking combined with high blood pressure significantly raises the risk of heart disease, stroke, and heart failure. Reduced effectiveness of blood pressure medication. Smoking can diminish the effectiveness of antihypertensive medications, making treatment less efficient. Scientific research on smoking and blood pressure. Medical studies have demonstrated that Cleveland Clinic states that smoking immediately increases blood pressure and heart rate while reducing oxygen supply to the heart, putting extra strain on the cardiovascular system. Healthline emphasizes that quitting smoking can improve blood pressure and significantly lower the risk of cardiovascular disease within weeks to months. Mayo Clinic research shows that quitting smoking helps reduce long-term high blood pressure risk and improves overall health. Practical advice for quitting smoking. Quitting smoking not only improves blood pressure, but also provides numerous other health benefits. Here are some helpful suggestions. Seek support. Join smoking cessation programs or seek medical counseling for professional assistance. Use nicotine replacement therapy. Nicotine gum, patches, or prescription medications can help ease withdrawal symptoms. Create a smoke-free environment. Avoid smoke-filled places and inform friends and family about your decision to quit for their support. Exercise and maintain a healthy diet. Physical activity reduces stress and helps manage weight, while a healthy diet stabilizes blood pressure. Stay persistent and monitor your health. Quitting smoking can be challenging, but persistence leads to long-term benefits. Regularly check your blood pressure to observe positive changes after quitting. Quitting smoking is one of the most effective ways to lower high blood pressure and improve cardiovascular health. If you smoke, consider quitting today to protect your health and the well-being of those around you. Alcohol, beer, and tobacco. Their negative impact on blood pressure and cardiovascular health. Alcohol, beer, and tobacco all have detrimental effects on blood pressure and heart health. Long-term use of these substances not only increases the risk of hypertension, but also causes severe damage to blood vessels, the heart, and various other organs in the body. Numerous scientific studies have confirmed these harmful effects, making lifestyle changes essential for maintaining better cardiovascular health. Negative effects. Alcohol and beer lead to both temporary and long-term increases in blood pressure, reduce the effectiveness of blood pressure medications, contribute to weight gain, and elevate the risk of cardiovascular disease. Tobacco causes blood vessel constriction, immediately raising blood pressure after smoking, damaging blood vessel walls, reducing the effectiveness of hypertension medications, and increasing the risk of stroke and heart attack. Practical advice. 1. Limit or quit alcohol and beer. Moderate consumption. No more than 1 drink per day for women and 2 drinks per day for men. Healthier alternatives. Replace alcohol with healthy beverages such as water, unsweetened fruit juice, or herbal tea. If you have hypertension, minimize or completely eliminate alcohol consumption. 2. Quit smoking to protect your health. Seek support. Join smoking cessation programs or use nicotine replacement therapy to gradually reduce dependence. Create a smoke-free environment. Avoid exposure to smoke to reduce the risk of relapse. Get support. Rely on family, friends, and doctors for motivation and guidance in successfully quitting smoking. 3. Maintain a healthy lifestyle. Balanced diet. Limit foods high in salt, saturated fats, and sugar. Increase intake of vegetables, fruits, whole grains, and plant-based proteins. Regular exercise. Engage in at least 30 minutes of physical activity per day to help control blood pressure, manage weight, and improve heart health. Stress management. Practices such as meditation, yoga, or recreational activities help reduce stress and stabilize blood pressure. Regular health checkups. Monitor blood pressure frequently and consult a doctor if any abnormalities arise. Maintaining stable blood pressure is key to protecting heart health and extending lifespan. Reducing or quitting alcohol, beer, and tobacco, combined with a healthy lifestyle, will help you manage blood pressure more effectively. If you find it challenging to change your habits, seek support from medical professionals for a plan tailored to your health condition.